I'm Jen Audley. I'm the project coordinator for the CHIP. And Phoebe Walker is my boss and the director of community health here at the FERCOG. And Lynn Feldman is the co-chair of the CHIP steering committee. And today what we're going to do is 4 things. Phoebe's going to talk to us about our model of health and the new visual that we've developed for our model of health. Lynn and Jason Maloney are going to talk about our progress on the regional age and dementia-friendly action plan. Dr. Allison Vandervelden, CEO of the Community Health Center of Franklin County, is going to give us some updates about things that are going on at the health center that are helping us increase access to health care. And I'm going to do a progress report on our connectedness work, our work on reducing social isolation and loneliness in our region. So with that said, I'm going to pass it on to Phoebe, and she's going to do the first part.
Thank you. You're welcome. And you all have handouts, and you have a task before you of looking at the handouts and eating all the food on your table. So really nice to see you all. I'm the Director of Community Health here at the COG, and we are going to start with a quick overview again of what are we doing here and why are we doing it and who are we doing it for in one slide. So we're doing it for these 30 towns, the Franklin County and North Quabbin region, and our goal is that everybody who lives here will have the opportunity to pursue healthy lifestyles, to participate in shaping the systems that impact their health, and to achieve social, emotional, physical, and spiritual well-being. So it's a lofty goal, and we've been at it since 2016, and I think we're making great progress, and I'm excited about this new round of 5 years of work together. So as you may remember, last spring, we asked for your input into a new model of health because we had an old one that really wasn't working for us anymore as we understood more and more how interconnected different systems are. And in particular, we wanted a model that recognized the structural inequities that drive a lot of health outcomes, but also shows how we can overcome these and doesn't feel, frankly, depressing to look at. So a lot of you gave a bunch of feedback. We all looked at some samples. We voted at a meeting, and this is the one that we have ended up with. I just want a quick reminder, if you're new here or don't remember, this is the old one we used to have from the county health rankings and roadmaps with a lot of suspiciously specific numbers and a lot of things that seem to be missing to us that seem to impact health. So let's dig into the new one a little bit. So the new one begins in the dirt because health starts in the soil, just like in a tree, right? And here, this soil is sort of showing you the infrastructure, the resources, the systems and institutions that are the soil that feed the tree. And all those kind of negative forces of systems of oppression that kind of permeate the groundwater here impact our health are sort of shown as infiltrating up into the dirt, right? That's what we're starting out with here and what we need to change. And the watering can, that adorable little watering can, represents our ability to improve the conditions, right, by adding our voices at the table, by adding the voices of people who are most impacted by decisions at the table, by adding more money to the table, increasing the minimum wage, et cetera, a millionaire tax, and also advocacy for different bills, different policies, different other changes that we want to see at the town, the state, and the federal level. So the work of that watering can is basically the work we're all doing here in the CHIP network. We're learning from people, we're finding resources to address the social drivers of health, and we're advocating for better policies and systems. So what happens after the soil? The trunk and the branches. And these are the systems and social drivers of health, formerly known as social determinants of health, but that felt very determinant, so we don't use that language anymore. And we've basically divided up the main branches here into the categories from that model of health that we just looked at, because those still work for us, these big clusters of the physical environment over here, the clinical care, the social and economic factors, and then the health behaviors. We feel like those chunks make sense to all of us, and we've been working with it a lot. And in the smaller branches, you can see some of the regional priorities in each of those big buckets. So, for example, when we're talking about physical environment, we mean transportation of all kinds, housing, soil, water, places to play and exercise, and those are all the smaller branches off the physical environment branch. This took a long time with the graphic designer. Okay, so then the very top, the thing we're all sort of pointed toward, is the positive health outcomes. And so that's what's happening in the leafy part of the tree here. And the leaves could say pretty much anything, right? There's so many different positive health outcomes that could be in these leaves. These are the ones many of the ones we're working on together in this chip. But there are different versions. There could be any number of versions of the leaves. And basically, each of you here is doing something that shows up in those leaves, like Jansen and Karen are both working on access to healthy food and building connectedness. Meg and Mike are working on bringing health screening and referrals to isolated rural adults. Nancy's working on improving healthy relationships and mental wellness, right? So we're all in this work together in those branches. And so what are we doing today? Let's get to the actual fun part. Today we're talking about 3 of them, right? The age and dementia friendly work, the access to healthcare progress, and the social connectedness progress. So those are the 3 sections of the leaves we're going to be digging into today. Any questions about this tree?
Isn't it great?
You don't have to love it. It's okay if you don't love it. We just really like it. All right, so let's get started on the meat of what we're doing, what we're seeing for progress. So I'm really happy to introduce Lynn Feldman and LifePath's brand new age and dementia friendly program manager, Jason Maloney, who's going to be sort of quarterbacking, leading, coordinating all the work that's happening in all these different areas around how to be more age and dementia friendly. Based on that action plan that was released in this very room in 2023. So why are we prioritizing this work? I mean, we are, as people I think all know, a rapidly aging region, and our systems, our physical environment, and our culture isn't really ready yet. And all the improvements that would make us a better place to age and have dementia would also make us a better place to have a toddler, or a teenager, or a disability of some other kind. So that's the reason why we're doing this work. And now one of you is going to come up here and talk about it, or both of you. All right, come on up, and we're going to do a little quick slide shuffle. So, Lynn Feldman, Associate Executive Director of LifePath.
Nice to see you all. Thank you so much.
Here's your clicker.
Okay, so fabulous.
That goes to the next one.
Thank you. So here with just a quick background on the Age and Dementia Friendly Project, a refresher for some of you, but Phoebe mentioned the reason why we are doing this project is because we have a changing demographic situation here in Franklin County. So overall in the United States, the aging population is growing. By 2030, 1 in 5 will be 65 or older. And by 2035, the number will be greater than the number of children under 18 for the first time. So we're approaching this as a country, but also specifically in Franklin County, by 2030, 1 in 3 will be 65 and older, quickly changing up from 15% in 2010. And overall, the Massachusetts number is a little bit lower. So what we're seeing here is that Franklin County in particular, the median age is rising more quickly than in both Massachusetts and the country as a whole. And in fact, Jason pointed out that Franklin County now has a similar 65 plus population, about 22% to Florida. So we think of Florida as a place where there are a lot of retirees, a lot of older people. Well, Franklin County is looking just like that. And in fact, we are going to outpace Florida's 65 plus population very soon. In just a few years, we'll be more than 50% higher. Why aging and dementia-friendly communities? So this initiative works to ensure communities can be places where all people can live, age, and thrive by always considering the needs of older residents. These changes benefit all residents of a community. In a simple example, as Phoebe mentioned, the idea of if you put on a ramp on a public building to increase the accessibility for older people, that ramp helps other people who have disabilities, people with strollers, a delivery person, and so forth. So There's lots of good reasons to work toward becoming more age and dementia friendly, not just because there are a lot of older people here. And the other thing to note about age and dementia friendly communities is that it's not a cookie cutter process. It's not a checklist that we've been given. It is a process of community engagement and for the community, by the community, of specific activities that we want to do here to make our community more age and dementia friendly. So our project, this is a little, kind of a cute little road map that we created a while ago to describe our journey to becoming age and dementia friendly. So step one, back in 2020, we enrolled in the national network and created this coalition. That was during COVID days when we received our initial funding from the Massachusetts Community Health and Healthy Aging Fund, which we're very grateful for. The second year, we surveyed older adults and analyzed those responses. So we heard from more than 2,000 individuals in our community about what they'd like to see as they age. Working groups made up of community residents as well as professionals analyzed that information and identified key priorities or the problem statements that we were trying to solve. And then the steering committee, together with the staff and other participants from the community, created the action plan, which is something you all have on your tables and that we have been working toward is sort of our roadmap to what we as a community in Franklin County and the North Quabbin feel is our journey to becoming age and dementia friendly. And here we are at step 5. We are ready to implement. So I'm really excited to announce that we have been funded again by the Massachusetts Community Health and Healthy Aging Fund to support this work. And we also have received a grant from Point 32 Health Plan Foundation. So there's a lot of great resources now coming into our community to support this work, not just to provide staffing and technical assistance, but also to provide some project funding going forward. And then in the future, as we once we implement our goals from this action plan, we will look to do continuous improvement and then evaluation, and just the journey will continue towards becoming more age and dementia friendly. This is just a snapshot of where we are. We went to all of our communities, each town signs on and commits. Their select board signs a commitment letter, and that town becomes then age and dementia friendly officially through the AARP designation. We have 28 towns sign on, all 26 towns in Franklin County plus 2 towns in Worcester County have signed on to become age and dementia friendly. And we want to just take a minute to note that this would not be possible without the collaboration of many, many organizations. So while LifePath is taking the lead and is the backbone organization for this project, our key partner in this is the Franklin Regional Council of Governments, and other essential partners are listed here. So we're working together with sort of the Aging Services Network, LifePath, and the Councils on Aging and Senior Centers, as collaborating with government entities and community-based organizations, all working together. And in the action plan, you'll see things that are happening sort of independent of LifePath or independent of FERCOG, sort of things that are spinning off on their own and taking place. And there's just a lot of momentum and energy coming from everybody who's been involved in this process. One of our goals will be to try to capture and track all of the great things that are happening, which is an exercise that our new Age and Dementia Friendly Program Director has been trying to grapple with the last few days, is keeping track of everything and reporting back to the community what's happening is going to be a big part of this project because there's so much great work. Speaking of accomplishments, so this wheel represents the 8 domains of livability, which you'll see in the Age and Dementia Friendly Action Plan is how the plan is split up. So outdoor spaces and buildings, transportation, civic participation and employment, communication and information, respect and social inclusion, social participation, health services and community supports, and housing are what the World Health Organization and AARP have determined are the important pillars of aging well. And we are excited to report that we have had a number of accomplishments within the 8 domains of livability. I'll go through a few of them now, just as examples. It's not by any means exhaustive, But some examples, in outdoor spaces, we have been able to add benches, accessible trails, and walking groups. For example, in Greenfield Hillside Park, there are now shaded benches done through Community Preservation Act funds. There are also benches now placed in Buckland on their walking trails. Leiden did a walking trail as well, and Irving has a new accessible trail near their library and senior center.
And also a bench.
And bench. Thank you, Rachel. So exactly, there's so much happening, and it's not all captured here, but these are just some examples. Under transportation, FRTA has engaged a travel ambassador, which will be a great step in helping people to access public transportation. And a number of communities, including Conway, have established volunteer-operated transportation services. Under the health, down here on the bottom, health services and community supports, LifePath has received grant funding to open a benefits enrollment center, which will help older adults get access to the benefits that they're entitled to live well and to have economic stability. Bernardston has spearheaded a new initiative that covers 8 towns to provide hybrid and Zoom programming. This is the Bernardston Senior Center. They're looking to provide virtual YMCA, mini trainings on the RMV, access to the Bay State Patient Portal. They're really trying to educate people on how to better access all these resources that are available to us. And then there have also been some new public health nurses engaged, in particular the North Quabbin Public Health Collaborative and the Valley Health Collaborative. So that has seen some development over the past few years. And those are a great support to older adults and just aging in those communities. And then finally, civic participation in employment, just a couple of examples. There are several towns that have passed senior tax work-off programs, which are ways that older adults can reduce their tax bills and become more engaged in their communities by volunteering. And Northfield has done a significant investment in accessibility for their public meetings. Now, looking forward, we still have a good bit of work to do with our action plan. We're looking to, under housing, we would really like to incorporate the input of older adults into the creation of accessible, welcoming, and affordable housing, which is a big project that we have ahead of us. We want to research and distribute information on municipal policy barriers to housing affordability as well through zoning ordinances. Under social participation, we would like to see an increase in intergenerational programming, and that's something where LifePath is having some initial discussions about. And we would like to, along those lines, facilitate collaborations between senior centers and schools when possible. Villages are neighbor-to-neighbor programs that make it easier, safer, more convenient to help your neighbor if they need some support. And these programs are a key part of our action plan because they support things like transportation, aging in place, and social companionship. And it's a major goal of ours in the action plan is to encourage the development. Right now, there are 5 of them that are up and running and 3 that are in development in Greenfield, Athol, and Orange. Greenfield, Athol, and Montague. Councils on Aging do such great work, and we have made it a priority to help spread the word about senior centers and councils on aging and the great work that they do. And then we want to encourage the use of newsletters. We found through our needs assessment that those communities who have either townwide or council on aging newsletters, people felt more connected and better informed. So we are recommending it as a best practice for each community to implement a newsletter. We want to also work with town municipal vulnerability planning teams to explicitly incorporate age-friendly elements into their municipal vulnerability plans. So the needs of older adults, especially those that are isolated, are included, and FERCOG is taking the lead on that. And we also would like to ensure the access of low-cost internet service and devices to those who need them. So that we'll be working together with those organizations who are recent awardees of digital equity funding. And then finally, respect and social inclusion. We would like to host dementia training. So Meg Ryan has taken the lead on providing information on dementia to pretty much any group who would like her to be present and do that. And so we're going to continue to make that available and encourage organizations to host dementia trainings, cater to the audience. So whether it be bank tellers or store employees, we would like to get more of the private sector engaged in that work. FERCOG Public Health is looking to provide technical assistance to towns and councils on aging on best practices with people living with dementia. And then LifePath is also looking to increase its elder abuse awareness training and campaigns. That's on our to-do list. So these are a lot of specific things, but a broader mission is, as Phoebe mentioned, a culture. So changing attitudes. For example, for a younger resident to respond to seeing a person living with dementia in a way that's compassionate and helpful, and for older adults to feel safe, comfortable, and welcome. So before I take questions, I want to just take a minute to introduce Jason. So Jason Maloney, if you would just come up, and I want to give credit to Jason for putting together this wonderful slide deck today and for coming up to speed really quickly on everything that we've got going on. So Jason comes to us with incredibly already has age and dementia-friendly project experience, especially for marginalized older adult populations. For example, Jason helped create the first dementia-friendly neighborhood in Chicago during his time at UChicago Medicine, and he also was deeply engaged with a village also in the Chicago area and helping to support older adults and their families in care planning as part of that project. So I don't know if you want to say anything more about your experience and let people get to know you a little bit, and then we'll go to Q&A.
Yeah, well, I'm thrilled to be here with everybody today and to be joining this work at such an exciting time. You know, it's not often that when you start a job, you can actually be handed a plan, nicely formatted, of at least, the broad strokes of where, we'd like to go with this initiative moving forward. As Lynn mentioned, I have done kind of systems level work on behalf of older adults, including people living with dementia and caregivers for about a dozen years now. That still puts me kind of early on the learning curve here, but I'm familiar with these concepts and I'm very excited to be a part of it. And I hope that I can be an asset to, everybody here in the room who wants to get engaged in this work, who has a great idea, and so on and so forth. But it's an exciting time. Lynn mentioned early on about some of the demography of this particular county, and it is, it does sort of skew on the older side, and I think that's a wonderful opportunity for us to look at model initiatives that might be, replicated elsewhere for how to kind of accommodate the older adult population fully and compassionately and with open arms at all levels. And, it's funny, we tick off these initiatives, but really, there's so many other groups that, should be involved. This is a community-wide effort, everything from healthcare providers to schools, to shopkeepers, to you name it, first responders, it goes on and on. But we have big ambitions for this. We have fantastic collaborators. And I'm just really delighted and humbled to be joining at this point in the project. So I think our next step, we just have questions if anybody has any.
Comments or questions? Yeah, Becky?
So I am just starting to learn about some of the implications of the housing bond bill and some of the policy things that went along with that, which include accessory dwellings by right, I understand, in single-family homes, and so I'm just wondering how to build on that in particular in our region, because how does that kind of thing get implemented? How do what are the steps? How does that influence what we're doing on that?
Do you want to speak? Yeah, do you want to answer that, Jessica?
So I'm Jessica Atwood, the Director of Planning here at FERCOG. One thing to keep in mind is with the ADUs, the state hasn't issued its regulations yet, so there's still a lot of questions about exactly what you're talking about, how it's going to move forward. And in a rural area like ours, in communities that are individual houses relying on septic systems, there's factors you have to consider about that as well. So I think part of it is there's still information to come out that we don't know yet. But we a lot of people are talking about this, and it's definitely something that's on everybody's radar. So as soon as we get more information, we'll be able to send it out to folks.
So the broad strokes is that the accessory dwelling units will be available by right to residents. That's the broad stroke of the law, is my understanding. So that is an improvement and does make our work easier with the action plan, depending on how the regulations end up.
Yeah, and the conditions of, like I said, with the septic systems is a situation with this as well, and the rural communities.
But
So it's not jumping up and down yet, but it's a good thing, and the housing bond bill is definitely positive.
Well, I was going to say it's not so much a question, but I wanted to underscore that the travel ambassador is the fabulous Elizabeth Quirk, who is sitting in the glass box out there. So, because she's working, she can't go on the bus. So, if you are an organization that wants someone to come and talk to you about how the FRTA works, hit her up on your way out the door, because she's here many days of the week for partial days. And just so in case you're wondering, what is a travel ambassador? You can see one. You can see us.
Thank you.
Any further questions?
Nancy?
You mentioned someone who does, and I think you pointed to somebody back here, but they're behind me, who does dementia trainings. And I would.
Right on cue.
Yeah,
I'm a public health nurse, and I have a range of things that can be presented.
Oh, great.
From
Yeah.
10 to 15 minute dementia awareness to more in-depth hour-long presentations about dementia or communicating, etc.
Yeah.
So,
Thank you. Oh,
yep,
They're great presentations.
Yeah.
And Meg's work is made partly possible by the Massachusetts Community Healthy Aging Funds and Point 32 Health. So we're really grateful to our funders. I'll just say that if I didn't say that properly before. And thank you, Meg, for all your hard work to make this.
I'm delighted to be doing it, and I'm thrilled that Jason is with us.
Yes.
Same. And it's fair to say that your trainings you can work with audiences that are providers, with lay, with,
Yes.
Yeah, okay. So it's a great resource. Did you?
Karen?
Yeah, I think the question about ADUs sort of gets to the reality that the younger generation and the person who's older with dementia is doing a lot to support those people. And so I'm wondering if the work that you're doing, if there's a piece of that, I heard your background is in part caregivers and families, supporting them, is addressing that at all and supporting people who are performing that way in their family. I'm doing that right now. It's a part-time job, to do that for somebody with dementia. And so I'm realizing how helpful that could be to have support for doing that work.
Yes.
Yeah.
Yeah, the caregiver support is a crucial part of the work that LifePath does. We have a lot of resources that are available for caregivers. And in fact, we're planning a big campaign in November because it's Caregiver Appreciation Month. And so you'll see like a billboard and some other things going on. Hopefully raising awareness of the resources that are available to caregivers, because it's a group that does need support and recognition. And as far as it connects to the age and dementia friendly plan, it doesn't have we don't have a specific action item related to that, but maybe we should next time around. And it's like a pretty important group. So thank you for raising that.
There was a statistic in the CHIP report that really stuck out to me, and I'm going to get the number off a little bit, but that the waiting list for home health aides is like several hundred people deep. So I think that, yes, ADUs and every other possible creative solution to addressing the needs for both professional and family and friend caregivers should be on the table, in my opinion.
Agreed. I'm going to one final question. I know that there are a lot of people here in this room who formally and informally are also working on the Aging and Dementia Friendly Action Plan. If you identify as one of those people, would you stand up so we can see who those people are? Who's working on Aging and Dementia Friendly here in Franklin County?
Judy?
Yeah, I
Jessica? Formally or informally?
Yes.
Your housing application for help?
Yes. That's Jessie from LifePath. She's 3 days in, but she's working on it.
She's trying not to stand up.
We're going to make it happen. So thank you, Jen. That's great.
I hope this is not inappropriate, but yeah, right. In terms of intergenerational programming, I just want to make a quick announcement that this Saturday night, we have an intergenerational dance happening. It's probably going to be moved to Don Moran's dance studio on 88 Hope Street. Right now it's the YMCA, but I think it's going to be a smaller crowd than we anticipated. But the evening starts with older adults teaching dances from the 50s and 60s, and we work our way all the way up to Greenfield High School students teaching us TikTok dances. So it really is intergenerational in design. So please come, 6 o'clock. Saturday night.
Thank you.
Register online.
Is that done?
It's probably going to, we're meeting at 3:30. We have an emergency dance meeting. Right after talk about whether I should move it to Dawn's studio, but I think that's probably what's going to happen, because if we're in a big gym and there's not as many of us, it's kind of weird. So.
And if people were looking for something that they could share online, is it on the GCC community engagement website, or where is it?
It is, yeah. I mean, if you go to the GCC website and type in dance, it's called Dance Through the Decades. So it's easy to find. Don't let not registering prevent you from showing up, though, because I will accommodate anybody who shows up, whether they registered or not. Come dressed as your favorite decade.
Ooh, challenge.
Thank you.
All right.
Okay, thank you all so much, and thank you,
Yeah,
Phoebe,
thank
for
you.
your partnership on this. It's been really
Absolutely.
wonderful.
It's great to have you here, Jason.
Thanks for
Likewise.
inviting us.
Thanks. Thank you, everybody.
All right, so we are now switching to an update on healthcare access, and you'll see in the CHIP book on your desk that there's a lot of different things that we're looking at for healthcare access expansion, and the one we're choosing to focus on right now is the great work of our federally qualified health center, the Community Health Center of Franklin County. And so I am excited to introduce Dr. Allison Vandervelden, the CEO, to tell us a little bit about what is going on at the health center in terms of increasing people's access.
Thanks.
You're welcome. You have to here's your clicker. Oh, I don't know if you're gonna be able to do it. Do you want me to click?
I can do it.
Okay.
I am a woman of many talents.
Yes, you are. So
Start
just
by-
go click from that one. Yeah, this, yeah. There.
Great.
Perfect.
Okay. I have to be a little bit full disclosure today. This is my second presentation, and I prepared better for the first one. So I have a lot of slides here, and I'm going to kind of fly through them a little bit, and I may talk a little bit about things that aren't on the slides, and I may occasionally read from the slides, and there should be plenty of time for questions. So, as Phoebe said, I'm the CEO. I'm Allie. I'm the CEO for the Community Health Center of Franklin County. And I want to talk a little bit about what a community health center is before I start talking about all the great things we're doing. I find that we are, unfortunately, the best kept secret in healthcare. And it's because we are local nonprofits who are under-resourced, and we just don't put a lot into marketing the way other healthcare institutions may. So I'm going to give you a little bit of background, and I can talk a long time about health center history and the health center legacy. So I'm going to do the short version here for you all, and if anybody wants to know more, please come chat. So I'm going to leave this slide up. I'll talk a little bit just about what it means to be a health center. The community health center, and being a federally qualified health center in particular, the concept was born out of the civil rights movement of the mid-20th century. The first community health centers were experiments in rural Mississippi and in Boston. And the question was, if we provide resources for people beyond, medical appointments and medicines, can we improve their health outcomes? Because at that time, and actually still to this day, there were enormous health inequities that were just desperate to get some attention. And one of the key statistics that we always cite when we're talking about community health centers is at that time, Black infant mortality was more than double that of white infant mortality. And in some areas, it was as high as 20 times higher. So just based on those social factors. Today, we are a movement, and it's evolved quite a bit. It was a successful experiment, and now we have 1,400 community health centers in the U.S., and so Franklin County is one of those. This is a little bit of an updated slide. The data here is from 2022, and I can say that in 2023, we actually, as a as a movement, serve 32.5 million patients in the U.S., which is a huge number of our population. Community health centers focus on people who just have barriers to care. So that could be people with disabilities or people who are experiencing systemic oppression, people who are better served in a language that's not English, people who have experienced stigma and disrespect. And we serve young people and old people and the veterans and unhoused, but we serve everybody. And that's the whole purpose, is that we are your community's health center. So there is nobody who is not eligible to be a health center patient. And I'll just say my own family are health center patients, and I've been unbelievably impressed by the care that they've been receiving. So I like to just say that, put that out there. One of the defining features of a community health center is that our board of directors is required by statute to be patients of the health center and community members. I have several board members in the room here who are patients of the health center and who are supporters and community members, and so thank you for that support. One of the main purposes of our board is to figure out what the community needs and wants and steer the organization in that direction. It makes us really, I think, special, and it's not a light load. So I just want to say, put that out there. It's really meaningful service, and it's not a light load for our directors. This is our mission, and I'm just going to read it. I've got it here. I'm just going to read it because I like it a lot. We've updated it this year. Our mission is to champion community health by delivering accessible, integrated healthcare, collaborating with patients in the community to improve length and quality of life, and emphasizing healthcare as a fundamental right for all. So I'm going to move a little bit into us. We serve Franklin County and the North Quabbin area, and you can see our two locations, our two primary locations, I should say, marked by the arrows on that map. We're located on Main Street in Greenfield, and we have a site at Health Center Plaza in Orange. We also have a dental-only location that's at BFMC, which it's kind of a special satellite site, and we can provide a lot of urgent dental care there. Coming soon, another site in Turner's Falls, which I'll talk about in a moment. This is just a summary of the services we provide, and there's a handout that also has this information. Generally, it's primary care. We aren't a specialist. We're a primary care provider, but we do a lot of services integrated in with that primary care. And as I mentioned before, there are no patients who don't belong at the health center. We do have also dental care, and I'll just mention our access to dental care regionally is probably the biggest challenge for all of us, but we are taking new patients at this time. And we have a small behavioral health department, and then enabling services, which includes all the wraparound services that just help break down those barriers for care. And this is just giving you a little bit of sense of who we serve. In 2023, we served 8,065 patients, and it's a broad service area, 52 different zip codes. So I've just listed the top 12, which is 77%, but it's a pretty spread out region. This is self-explanatory. The number of homeless patients has been climbing, and I think that's related both to our ability to serve folks and to break down those barriers, and also just the increasing severity of the housing crisis. And then I just wanted to highlight who pays us. We bill medical insurances. We have sliding fee discount scale for those who need it. And ability to pay is not a barrier to getting care at the health center. And we take fancy private insurance also. So,
Allie, how many,
yeah.
do you have a sense of how many patients have no insurance?
In Massachusetts, we're fortunate that is a fairly small number, and I can't tell you exactly what it is. It's less than 5%. I feel pretty confident about that. However, that's like in a moment in time. There are plenty of people who, throughout the year, find themselves uninsured and need help getting re-enrolled or getting enrolled in a different plan or a connector plan or navigating Medicare. So I think this is through the course of a year. But generally in Massachusetts, especially because we are a health safety net provider, very few people don't qualify for anything. But there are some. And there are some folks who just, maybe they qualify, but it's so arduous to get signed up that they don't, it's a barrier. Let's see. So I'm going to talk a little bit more in detail about these, but our CHIP goal is to expand access to clinical care in the region. And these are some of the current projects that we're working on at the Community Health Center. And I want to highlight them because they're big projects. Some of these things are quite large projects, and I'm really excited to share them with you all. So I'm doing these in chronological order here a little bit. Our new site in Turner's Falls. It's the location of the former Connecticut River internists, and we purchased the building last year and have been renovating it, and it'll be ready to go. I think we'll be seeing patients in December. That site is a large, I don't know how many people have seen it or are familiar with the building. It's a large facility. We're going to start by having 3 to 4 providers in that location, and there's going to be a little bit of room to grow for us over time. That's going to expand our capacity 2,000 patients to 4,000 in the future as it grows. So if you remember, we saw 8,000 patients last year. This is a 50% increase potential there, and we're already hired. We already have staff for this site. They're amazing. It's an amazing team. And so, we're ready. We're taking new patients, and those folks are already working. So, the next big expansion we have coming is the addition of the pharmacy service. So this is going to be located at our Health Center Plaza in Orange, but we're going to also be providing delivery service for pharmacy. And it's going to really improve coordination of care for patients. Often we think of pharmacy as like, oh, you go and you pick up the drugs that your provider sent in. But actually, the pharmacist is a key player in the healthcare team. So having our own pharmacy is going to allow our providers to just understand what's happening with the medication side and have the pharmacist be able to just connect with the providers about shared patients. We'll have all the information in the same medical records system, and we will also serve patients from outside the health center. We'll be providing things like blister packaging to help organize medications for folks, particularly polypharmacy patients. And one more thing to say about pharmacy, which I've forgotten, but that's okay. If you have questions, you can ask.
Was it about delivery?
Yeah, did I mention that? Yeah, we're going to do delivery. And it's going to really, I think, be helpful, particularly for maintenance medications, for chronic conditions, to just have your refills sort of connected with your primary care provider and delivered. We're hoping to have, to serve the majority of our patients in Orange, as well as many of our patients from our other locations. And Orange is really the easternmost part of our service area. So I don't expect that folks from West County are going to be driving out there. But if we can get the refill medications, do it in an easy way, I actually think it'll be a nice service. And then the mobile health unit. So this is something that's still in the planning phase, but I'm expecting sometime during calendar year 2025 that we will add a 2-room treatment clinic on wheels to help serve the areas that are just not getting enough attention, and some of our priority populations. Right now, it's looking like our farms to help serve more of our agricultural workers, as well as our West County patients who are seeing some significant decrease in access to care. This will be an addition. This is basically adding a very small clinic, and so I expect it'll add about 1,000 patient capacity for us. So,
Sorry.
do you want me to go? Yeah.
I was reading MHU.
Oh yeah, mobile health unit. Yeah, sorry. And then this is a little different because this isn't a physical expansion, but I just wanted to mention the collaboration that we are participating in. The health center is a fiscal lead for a United Way Aligned Impact for Youth Mental Illness project. The purpose of this project is to get people in the community at the table. We're well positioned to help facilitate connectedness and collaboration because the community health center already does that. We already want to. We know we cannot serve everybody's needs, and we know that our mission is really to improve the health of the entire community. And so making those connections is work, and what we're hoping to achieve is to get everybody at the table, people who serve youth, young people, and providers of behavioral health care, and just sort of connect the dots. Who needs what? Who's doing what? How can we think creatively to solve this problem, in a way that, isn't duplicating efforts and isn't leaving people behind. And we may have some capacity also to fund a small amount of services that aren't clinical. A big barrier for behavioral health services is, insurance. If you can't bill insurance for it, it's very hard to make a sustainable program. So we're looking sort of outside the box on that as well. And that is the end of my content. So I'm wondering if there's any questions. Yeah.
I don't need you to, quote a precise number on this, but I'm wondering if you can ballpark. How many of your visits would you say are with patients that are 65 or older?
I took that slide out. I could tell you exactly afterwards. I have it in here, but I think this year it was 25 to 30%. Okay. We really reflect the population of the region, and so we're seeing the exact same trend when we're expecting that 65 plus age group to continue growing. Yeah, and we have definitely have an interest in making that care accessible. So.
You have a question back.
Oh. Yes.
Hi, yeah. My name is Alana. I work here at the FERCOG. I think that sometimes when I'm talking about the community health center, people have some of the real basic questions like, do they have any openings right now?
Yeah.
How would I find that out?
Yeah.
If I got in, how long would it take me to get an appointment?
Yeah.
So I'm wondering if there's a way that I can help people to find out that information.
Yes. So, yes, we are taking new patients right now. I think for a new patient visit, there's no wait lists. I think that the appointment's probably 4 to 6 weeks out, somewhere in there. I think if there's an urgent issue, that number can be made smaller. And then where do you find information? So our website, chcfc.org, has a lot of information there. Unfortunately, it is not set up yet where you can register as a new patient through the website, even though it does have the forms. And we do, because we're highly regulated as a federally qualified health center and have a lot of reporting, we have a little bit of a bulky registration packet. We ask for a lot of information. But the forms can be found on the website and then can be returned to the office, or you could call just call the office that you want to go to. And we're actually taking new patients right now at all 3 locations. We've added staff and sort of squeezed them in to the 2 existing medical sites in order to prepare for this transition. And so those new providers are there and ready, and it's like an amazing team, I should add. I'm really proud of our medical team.
One just quick follow-up question related to that is, I know that you're really working to be available for unhoused patients and maybe some other people who may not have access to technology all the time. So do you have multiple ways of reaching out to patients? Like, call them, you could do this, like, how do you communicate with your patients mostly?
So for people we are not yet connected with, we do attend events and have outreach and enrollment people in various different places in the community. We also collaborate a lot with local partners. So, if somebody is connected with, let's say, community action, they can say, oh, you need a primary care provider. Here's some information about the health center. And we have some, for certain populations, we have some sort of fast tracks. And for folks who are health center patients, we have standard phone. But when we're trying to reach people, it's phone, portal, and then you can always stop in. So I'm not sure if I've fully addressed it, but really it's sort of networking. And we do occasionally lose folks. People have complicated lives sometimes, and things will come up and they'll sort of drop. And, we try to keep up with where's the best place to find you. So.
That's great, thank you. Yeah, and the reason I asked that question is a few different people of various ages, but especially some older adults recently have talked to me about how they find it really hard if the portal's the only way they can reach their provider.
Yeah.
Because they find the portals really confusing, and so I've had like at least one person be like, I told my doctor just text me, and they won't text me.
Yeah.
And I'll be like, well, they're not allowed to just text you.
Yeah.
Definitely on the age and dementia.
It is, yeah.
It's all,
Action plan.
and it's really understandable. So just the fact that it's okay for people to stop by, and that you will also just use the phone, which seems like a really basic thing.
Of course, the phone is challenging too because we do have a phone tree. It's not like it used to be, and it's just because we're larger. We are also participating in a project to help develop some of our staff as digital navigators, both for telehealth and that sort of thing, but also just like as a social driver of health. If you can navigate the internet and technology, then you have more access to more things. And so we are developing some capacity there as well. And unfortunately, the portal is the best way because it goes straight to the right guy.
I love my portal,
I know,
my provider, but it's like I really
it's not for everybody.
some people
Yeah, it's very challenging.
It's just hard. Thank you so much.
Taking too much time.
Thank you. You're all good. Thank you very much. And wanted to shout out John Gould from Senator Mark's office joined us here. Thank you very much for coming. You missed the slide where we were talking about how vitally important bills and policies are. And so you guys are our absolutely critical partner in that work. So thank you for being here. Our last update is about the work that the CHIP has in mind for increasing social connectedness. And Jen Audley, our fabulous backbone of the CHIP project coordinator, is going to come tell you about the work of the CHIP Connect group and some cool grants that we have coming up.
All right, I would like to thank Allie and Lynn and Jason for their presentations today. It was so great to learn about those two things. And I hope that like me, you saw how connected they are. And, when I looked at the stars that Phoebe lit up on the tree, I thought, well, I could put a lot more stars there. Like, we're working on all kinds of outcomes here. And, Allie just now talked about digital navigators at the health center, and that's part of the digital equity work that's happening in our region. There's a lot of connectedness in this work, and that is one of the reasons why the CHIP network chose to make social connectedness a priority for this cycle of the CHIP. Another reason is because while social connections have historically been a real strength of our region and of rural regions in general, this idea that people belong to organizations and groups and they know their neighbors and they help each other out, that has been less true in recent years in our region and in other rural places. And a lot of the networks and the organizations and the clubs that people used to form that web with really got impacted by the pandemic. A lot of things changed, they morphed. Some of the things went online. In some cases, being online was a real improvement for people. It gave people access that they had never had before. And then when the public health emergency started to decrease, for some people, things didn't get better. For some people, those networks didn't get restored. And those people tended to be people who were already disadvantaged. They already lived far away from other people. They already had social identities that made them not fit in with the communities that they lived in. They were already much older or much younger. They had disabilities. They had visible disabilities, invisible disabilities, all these different reasons why for some people it's much harder to have a social network. And so many of us who work in, human services capacity try to create that systemically. We try to sort of replace some of those human connections that you might have with your neighbors, your family, or your friends, or your club, or your church, but we can't do it all. So when we started talking to people about what they thought were the most pressing health needs in our community, that idea came up again and again and again. And it was clear that that was something that lots of people were working on and wanted to work on. In our surveys and our data, what we see is that both young people and older people in our community are really struggling. Interestingly, so I want to draw your attention to our new CHIP booklet, our new objectives and goals booklet. I put one on each table, and it's online now, and we're really excited about it. And it has a page for each of the CHIP priorities, so that I copied a black and white copy of the page for the 3 priorities that we're talking about today to put on your tables too. But you'll see that on the connectedness page, we highlighted the statistic that said that when we surveyed young people in our local public schools and asked them, how often do you feel lonely? About 40% said they feel lonely most or all of the time. And when we surveyed older adults in our community about how often they feel lonely, about 40% said that they feel lonely sometimes or often. And so this is a problem that is on both ends of the age spectrum, and it's across our whole community. The other thing I want to mention, first I want to make sure that I say that Dominic Pulley's here from the Greenfield Recorder. We're very grateful to have you here. And he's taking pictures too. So, again, at the beginning we said, if you don't want to have your picture in the paper, let us know, let me know, let Phoebe know, let Dominic know, and we'll take care of that. But I really appreciate you being here to cover our event. And then, sort of back to my script. This morning, I went to the United Way of Franklin and Hampshire Region's campaign kickoff event where Allie spoke. That's where she was at 7:30 this morning. And she was speaking about the aligned impact work that she described that's related to youth mental health and that involves working in collaboration with community partners. And Jeff Nonheim, who's sitting here in the middle of the room, who's the executive director of the United Way, spoke very eloquently about how important it is for us to do work as a region and to collaborate. And it just really set me up to do this part today about our work on social connectedness. One of the things that Allie said is, if we know each other, we can work together. And I think that's true for us here in this room. The better we know each other, the better we can work together. And it's also true for everyone in our community. So, one of the things I want you to think about is your own neighborhood and what you think of as your own community at home. And that's kind of what we're going to be focusing on with the connectedness work here in the CHIP. So my job today is to give you a progress report on what we've done so far. So what happened was that at the beginning of the CHIP planning process, we identified this need to work on social isolation and reducing loneliness. And of course we knew that this is also something that is totally in the news. It's a national problem. The US Surgeon General, Vivek Murthy, produced this advisory report about the healing effects of social connection and community in 2023. And what we decided was that a good way to start would be to get people together to really dig into this report, read the Surgeon General's recommendations, and think about how we could apply them to our part of the world. And so the first thing that we did at our launch in February 2024, just this year, 2024, here in this room, you can see, I had COVID during this meeting, so I'm not in this picture, but here are many of you and some other members of the CHIP network talking about this connectedness goal and talking about what we might do and starting to page through the U.S. Surgeon General's report. And we took that initial conversation and used it to create a study group. So the way that worked was that by the early spring, we had a group of people who had agreed that they would spend some time with me for 4 months or so exploring this topic. And the goal was to end up with a plan that is the plan that's in your booklet here. And so the way we did our work was a little different than how CHIP working groups had worked before. We mostly worked asynchronously. We tried to have assignments. We had like kind of online to-do list, and people could choose what they wanted to do, and they reported back by email, or we had shared documents that we shared notes on, and we created an email list so people could talk to each other. And then I also set up these weekly hours when I committed to be working on this project, and we had in-person time when you could join me and maybe write your reports on what you'd read or done or written, or and then we had a hybrid version of that too. So I had a Zoom going at the same time as we were having the meeting in the room. And then at the end, we had one in-person meetup where most of the people who'd been actively engaged in the group got together. It was in Judy Raper's office at GCC. It was awesome to get to see everybody. And what we did at that meeting was we really tried to kind of tie together the threads of our work and figure out what the next steps for the CHIP would be and how we would articulate our goal. So this is how I would describe the study group outcomes. What you can see on the side of the screen, the images of that page that's in the CHIP booklet, which describes specifically our objectives, and I don't expect you to be able to read it because it's on your table. But the objective is to empower a diverse group of community members to gain skills and knowledge related to increasing social connectedness and put them into action. So what we heard from people again and again as we read the Surgeon General's report and we explored what was going on was that the thing that people really wanted to do was to work on cultivating a culture of connection. This is something that is already happening in lots of ways here. Jansen's here from Stone Soup Cafe. Stone Soup Cafe is all about cultivating that kind of community. The work that Judy does at GCC is all about that kind of cultivation. So it's not like this is new. We're recognizing that we have some strength in this area and trying to leverage it and to add to it. And so we defined some very specific activities and outcomes that we wanted to get out of this. One of them is that we want to have a larger group of people from all walks of life in Franklin County who identify themselves as connectors, who think like, I'm a person who's good at this. I know how to connect people. So the first way that we did that is by forming that study group, which was quite a diverse group of people from all kinds of places. And we got them talking to each other. We got them to know each other a little bit better by working on a project together. The next thing that we want to do is we want to encourage activities, community-based activities, people to actually do things that will help them get to know each other, get to know their communities, get to know their neighbors. And so we started in August because Judy tipped us off to the fact that she had Jessica Gifford, who is Northampton-based and is the founder of a group called Project Connect, an approach called Project Connect, had come up and had given a presentation to the GCC faculty at a professional development time that was incredibly well received. People just loved it. And so based on that endorsement, we met with Jessica. We talked with her about whether She worked in community settings, and she said she has a little bit, but she was really interested in doing more. GCC was really interested in following up. And Judy and I decided that what we would do is we would get a whole bunch of people who we already thought were kind of proto-connectors to be trained to facilitate this curriculum that Project Connect uses. That is basically a rapid way of getting a small group of people to deepen and strengthen their relationships with each other. So this is like a 6-session, like you get together with this group of people and you work through it's sort of based on icebreakers. You get to know each other and you come away being able to work together better. So Jessica has used it successfully in lots of workplaces and on lots of college campuses and a handful of community-based settings. So we invited people from GCC, people from the Greenfield Public Schools, people from the Y, from the Opioid Task Force, from FERCOG's Partnership for Youth, from Mass Hire Workforce Board, from ServiceNet, from several of our senior centers, and some community members to do a one-day training in August. And 31 of them did it. So now we have 31 connectors already. And the next step for that group is really for them to do it. So one of the things that you will be seeing in the next few months is opportunities for people to join these Project Connect groups and get to have this experience. And also this is going to give the facilitators a chance to be able to practice and get more confident. And I think that it's likely that we'll also see more opportunities for people to get trained to do this curriculum. I put something on your tables from Project Connect because Jessica Gifford contacted us last week and said that she's been accepted by the Workforce Development Trust of Massachusetts to be a training that businesses that have fewer than 100 employees can have her trainings for free. I'm not explaining it very well, but the handout is quite good. And I am hoping that Judy will talk a little bit about what's coming next from the GCC perspective.
Sure. Can I do from back here?
Sure. Just talk loud.
Okay. So of the 31 people that were trained this summer, 10 of those people are GCCs. And I've been in higher education since 1986. And the shift I've seen in community has been pretty devastating. You know, when I look back to I worked in residence life for many, many years. So you can imagine what I saw in the 80s versus what I saw by the year 2000 once the internet came into being and so forth. And no coincidence that anxiety and depression among young people is on the rise, but it affects all ages. And I think sometimes, and COVID obviously exacerbated all that. And at GCC, as we have more and more online students, less and less in-person students, everybody's like, isn't this great? We have all these online students, we can serve anybody. I'm like, oh shit, what's going to happen to their social skills? What's going to happen to their, their love of life, their quality of life? And so I've been like the big voice at GCC, constantly talking about this stuff and driving people insane. But it's starting to catch on. And the 10 folks that were trained this summer, we came together this week on Tuesday to develop a plan for what we're going to do with our training. And so essentially we're going to do multiple things. One is we're going to target specific student groups on campus that we think could benefit from these trainings. We're also going to create random groups of faculty, staff, and students. We don't want it to just be student groups or faculty, staff groups. The idea is to get out of our silos and connect. And because I'm in charge of community education, also mixing some of those groups with people in the region. I had a call this week with Ginny Abels from the House of Corrections, and she's eager to introduce this in the House of Corrections. So my plan is to, in January, introduce this into that population, which I think would be a terrific population for this to be done with. And then the other thing that we're going to do, there's a training, there's a protocol, there's a curriculum, but there's also room for flexibility with this because not everybody is going to fit into, I can give up 5 hours over the course of 5 weeks. It's not always going to work that way. So the other thing we're going to do, I was on a Zoom call, Jessica had a Zoom call earlier this week, for people around the country who are using this curriculum, where we could share ideas. And there was one idea I really liked that we're going to do at GCC, and it's called Connection Cafe. And basically, on a bi-weekly basis, we're going to get snacks, and we're going to use some of the question cards that Jessica uses as a tool for her curriculum. And we're just going to say, drop in and let's talk. And because I think sometimes it's overwhelming to drop into a room of people you don't know just to hang out. But if you have structured questions that you're asking or structured team builders that you're doing, as much as people kind of go cringy about team builders, the reality is so we're planning on starting that next month, and yeah, that's what we're doing.
Yeah, thanks, Judy. So the last thing is that we're going to do mini grants. Fortunately, thanks to the support of our Massachusetts State Office of Rural Health, administered by Ezekiel, we have some funding to be able to support some community building projects in neighborhoods. And we're going to try to do it as a sort of pilot version. While we have this funding, we're going to try to do up to 10. The objective is really going to be to build social connections and resilience in Franklin County and North Quabbin in places that don't already have the advantages. Like, you might be thinking about how, I can think of a bunch of things. Like, my neighborhood has this tradition of this progressive Thanksgiving meal that is so fun, where all the people who kind of don't have any place to go around from each other's houses. We have appetizers at one house, and we have meal at the next house, and then we have dessert at the next house. And over the years, as things got complicated, one year we had the whole thing in a community building, and one year we just did dessert, but like that tradition has continued. And the reason why that works in my neighborhood is because people have time, they have resources, they have confidence about pulling something like that off. And so we want to make sure that we're giving support, both technical support and also financial support, to neighborhoods that have an idea, but maybe don't have one of those other things, or a few of those other things. So we're going to focus on communities that our colleagues at the FERCOG have identified as environmental justice areas, using the criteria that the federal government uses modified for Franklin County. So there are 10 communities that meet the criteria that the FERCOG uses. FERCOG created this report in 2023, and I put on your tables a two-sided handout that has a map on one side and the list on the other side, just of the Franklin County communities that meet the criteria. We're going to add a couple of North Quabbin communities. The report was a Franklin County report, so I have to add in, but it will be parts of Athol and Petersham, I'm pretty sure. So the criteria, in case you're curious, are that the median household income, it's census-designated Black groups, has to be below 65% of the median household income for Massachusetts. So the median household income for Massachusetts is $89,026 a year, and 65% of that is $57,867. And, or either of these conditions, where census data reports that at least 8.8% of the population identifies as being not white or not Hispanic. So in Franklin County, these are the communities that met those criteria, and we're going to focus on them first for this round. The people who are going to figure out how to do this, what the application's going to look like, who to choose, are going to be the CHIP study group, which is going to become a CHIP working group now. And I am inviting new members. Anyone can be a part of this working group, and we're going to run it in the same kind of flexible way, where we're going to do a lot of stuff kind of asynchronously. We're going to have meetings in person that you can come to or not come to. But if you want to be a part of this mini grant program, whether it's as a shaper of the program or an applicant, you are welcome to do that. We're going to issue our call for ideas in the beginning of November, I expect. And we're going to start giving out awards on a rolling basis pretty soon after that, depending on what kind of applications we get. So that's all I've got for you. I'm going to put the last slide up just so that people have that contact information, but I'm happy to answer questions if you have questions.